שלום, אני אלי דוידוביץ' ואני פיזיותרפיסטית, ואני רוצה לספר לכם על ספר שתורגם עכשיו לעברית, שנקרא אסטרטגיות שיקום. הספר מופץ בחינם לכל מי שרוצה, והוא מתעסק בטיפול בכאב כרוני. כתב אותו דוקטור ליהמן, ותרגמנו אותו מספר פיזיותרפיסטים. אני, אייל אייזיק, יניב נודלמן, רועי צייג, עידו רוקח והארון בלטמן. את הספר אתם יכולים למצוא פה בסרטון בתגובות, או אצל כל אחד מהמתרגמים, או אצל הרבה מאוד פיזיותרפיסטים. פשוט אפשר להוריד אותו מהאינטרנט ולהשתמש בו. אחרי הסרטון הקצר הזה אתם תראו ראיון עם דוקטור ליהמן בעצמו, שמסביר איך ניתן להשתמש בספר על מנת להיפרד מכאבים. תודה רבה.
Hello.
Hello.
How are you?
Good.
Okay. I'm just going to interview Liehman again. And we're going to talk about your book.
All right.
All right. אני הולכת לראיין את ליehman שוב. אנחנו הולכת לדבר על הספר שתורגם עכשיו לעברית. הוא מופץ בחינם לכל מי שרוצה. And I'm just going to ask you some question about the book.
Sure.
Okay. Who is it for?
Oh, good question. It was kind of originally for therapists to help their patients, but then I was writing it, I kind of wanted to be used for anyone that was in pain. It was originally set up that it might be like each page you could use individually. Like you don't have to read it cover to cover. You could just open it up randomly and read one page and it might be relevant to you. The other thought was the therapist might have a message about pain or injury or rehab that they want to get across to their patients. So they would just pick a certain page and say, here, read this, let's talk about this when you get back. So it's like one, pain little info bite, so to speak.
Okay. So as a patient, I need to just open one page and read it?
Yeah.
Is it the best way to do it?
Well, I mean, if you were just using it on your own, probably read the whole thing. Like the first three sections are, the first two sections are really talking about it, pain, explaining problems that people have. Not everything will be relevant to everyone, of course, because pain is always individual and it's your pain and it's your story. So some of it won't be relevant at all. And then the third section is sort of, we know pain is more than just tissue damage. Not that tissues are relevant, but it's everything in your life that can sensitize you. So it's sort of doing what we call like a self-audit, where you go through and try to figure out what's going on with your pain, and then maybe, hopefully, you can do something about it.
So it's exercises?
No, it can be, like it would be more, I use the example, pain is your cup overflowing, right? So the cup overflows, when that hits the ground, that's pain. So it's like, what is contributing, what's in your cup? What's making you sensitive? What's making you feel like you need to protect yourself? And some of that could be like, you're not going out with your friends anymore. You didn't realize that. You've just withdrawn. You're not doing the stuff that you love. You're not spending time with your kids. You're not picking them up. You're not exercising anymore. You're getting anxious and depressed. And then so you kind of choose, like, what are the things that I want to work on? Because not all of them have to be fixed. That's really unfair. You say, you know what, I want to do more. I want to go out more. So the last section is like helping you set small goals to do the things that you miss and you want to do, or where are areas that I need help, or it could be exercises too, or something like that.
Okay. Which kind of problems is the best to use the book? Which kind of people?
It's set up like the self-starter might be able to use the book completely on their own and get no help at all. Someone else who's working with a therapist, they would be able to use it too, because not all of it is immediately intuitive. It doesn't always make sense. So you kind of like, I don't know what this guy's talking about. Does this apply to me? And you can kind of work with your therapist to determine, what's relevant.
So if I have questions, what should I do with them? If I read it and I have questions.
Working with, your physiotherapist or your doctor, that would be the best idea. Because of course, everyone's pain is individual, and the book can't can't take care of everyone's problems and all their solutions. It just gives a couple solutions. And so, you know, your therapist might have more solutions than are in the book. Without a doubt, your therapist has more solutions than are in the book.
Okay.
Yeah.
And is it just for chronic pain patients?
No, you can look at it any type of pain or injury. Because ultimately, one of the big messages in the book is that we adapt and that we have to stress ourselves sometimes to adapt. It's just finding the right stress. Like you sprain your ankle, you're not just resting it. You might rest it for a couple days, but you're up walking pretty quickly. So the same principles for chronic pain, you know, apply to acute pain and injuries, the way I practice.
Okay. And you called the book Recovery Strategies.
Yeah.
Why is that?
I mean, I don't think it initially started like that. It was more like a pain guidebook. That might be the tag underneath it. I like the idea of like recovery strategies because it's more that we can be optimistic. You know, it's not, this is everything that's wrong with me. It's more like these are all the things that I can do. So it's focusing on like how you can help yourself rather than, you know, all the things that are problematic.
Okay.
Because you can have those things. I mean, I've had persistent pain before. I still do sometimes. I know those things are still existing that aggravate me. And some of them are hard to change. And so I don't have to change them. There's other things that I can do to cope with with the discomfort I have. And it's the same thing with my patients.
Okay.
Like, can I give an example? Or?
Yeah, but of course.
Yeah, because it'd be like something like depression or anxiety or osteoarthritis. We know people are going to have those things. We know they're a little bit related to pain, but you can't really change osteoarthritis. It's very difficult to change depression and anxiety, but you don't have to, right? You can have all of those things, osteoarthritis, tendinitis, whatever people are calling it, anxiety, and you can be out of pain. Or you can have some pain, but you can be living a happy and well life where you have no disability and no suffering. So that to me is optimistic. We don't always have to fix ourselves, right? And then we put too much pressure on ourselves to fix things.
So we are someone who suffers from any kind of pain should just read the book, go through it, ask questions
With their therapist or
therapist,
doctor,
and work with the self-work section in the end.
Yeah.
And just be free.
Exactly.
Okay.
I mean, to me, the be free is a good way to put it. My favorite part of the book is it's from a therapist from New Zealand who always asks, like, if pain was less of a problem for you tomorrow, you know, what would you be doing differently? And then our answer is, okay, we start doing that, but what's in the way? What are the barriers to you started? Okay, let's work on those. Yeah.
Okay. Thank you very much.
You're welcome.
Now the book is in Hebrew.
I know, it's amazing.
Yeah, I know. And it's everywhere. And you said you're going to do videos about it? How to use
videos,
it.
more like little blogs and stuff like that, like more information.
So we're looking forward to translate that to Hebrew as well.
Yeah, well, what people have to do is email me and like tell me what the book is missing or where they'd want more information, and then we can like build that up on the website. It's meant to always be free and open access.
Okay.
That's the total idea.
So it will be in one of the attached to this video as well.
Okay.
So
Cool.
you can get it for free, and thank you very much for your help
Oh, yeah,
for everything that you give us.
No problem. Thank you.
Thank you. Bye-bye.
Bye.